Good morning. My name is Brynn Ashley, and I'm one of the vaccine teams here at Clínica. And I am very honored to have a special guest with us, Dr. Irene Landaw. She's been a pediatrician for nearly 40 years. She retired in 2017 after 28 years of practice at Kaiser Permanente in Fremont. And during her time there, she served as the immunization champion and was an investigator at Kaiser's Vaccine Study Center, studying many new vaccines, which are now standard. Dr. Irene Landaw currently volunteers with the American Cancer Society's HPV Vaccination Roundtable. Today, she is not speaking on behalf of any organization and represents her own experience and views. We are so lucky to have her here to talk with us today as we embark on not only flu season, but flu season during COVID. And here at Clínica, we really want to empower all of our staff, medical assistants, greeters, COAs, everyone to help encourage our patients and families and community to stay safe during the flu season. So in order to do that, we wanted to bring Dr. Landaw in to give us a little information about the flu vaccine, a few answers to some of the common questions we get from patients and families that may seem a little intimidating, and just in general, some information about why we might want to consider the flu vaccine, not only every year, but especially this year. Thank you so much for being with us, Dr. Landaw.
Thanks for inviting me.
All right, so we have a few questions that we often get that I would love to run by you and see how you would recommend we address. One of the most common ones we get, unfortunately, in the age of information and the internet, lots of families come to us with, I read on Facebook, Instagram, Twitter, wherever, that the flu vaccine is really dangerous or has chemicals in it that are not safe or could even give me the flu. What would you say to those families?
Okay, well, there's a lot to unpack there. Let's start with gave me the flu. That's impossible. So I want to reassure everybody. In the flu shot, there are no live components. Nothing is alive. So you cannot get the flu from the flu shot. The nasal spray flu vaccine has attenuated viruses that cannot grow at body temperature. So by the time they get from the nose further down, they can't replicate. So you can't get influenza from either one of those. We can get into some common reasons why people might think you can get the flu from the flu shot, but it is physically, scientifically impossible. So that's that one. In terms of being dangerous, it's an incredibly safe vaccine. I personally have been getting influenza vaccine every single year. I've never missed it since I was a resident in the 1980s, before many of you were probably even born. And it's been fine. I did it for my children before it was even recommended universally for children, because my mother was infected with the AIDS virus, and we were trying to protect her by protecting everyone around her from the flu. So they've been getting it since they were 6 months old, and they're almost 30 now, my kids. In my practice, I did it for as many patients as I possibly could. It's been extremely well studied. It's given millions and millions of doses all over the world, and it is a very, very safe vaccine. And in terms of chemicals, I know some people worry about preservatives in the vaccines, but there are very few preservatives in there, and they're the same preservatives that are in other vaccines, and far less that preservatives than unfortunately are in our food system. So very, very safe. And you know, the internet is a hard place to navigate, and it gets harder all the time. The thing about the internet and Facebook is that there are not editors that are going through there saying, oh, that's not true, let's take that out. Or you didn't say that clearly, let's clarify that, the way there are when you publish a newspaper article or a medical journal article. There are people that are fact-checking you and also clarifying things that are complicated. And that doesn't exist on Facebook and lots of places on the internet. So at the end, I think Brynn is going to show us a few reliable websites that you can go to so that you can do your research, which I heartily recommend. One is the American Academy of Pediatrics, which is the Healthy Children website. One is the Centers for Disease Control. which has been talking about flu vaccines since long before we ever had this nightmare of a pandemic. So you can trust their information there. And the third one is one that's new to me that I thought was excellent, called Families Fighting Flu. It's written by parents for parents. It's not a medical site. And I think those are reliable sites that you can go to kind of fact check the things that people are, fear causes a lot of clicks on the internet. So the more you get people riled up, the more clicks you get and the more things rise to the top. And that's not the way you want people to choose the information that they're giving to you.
Great. Another common question we hear is the flu shot doesn't work. For example, I got it last year and I ended up getting sick anyways, or my child never gets sick, so I don't need it. How would you address those?
Okay, so there's a bunch of things in there too. Those are great questions. In terms of the, I got the flu shot and I got the flu anyway. There's a few different components to the answer for that. First of all, not everything that we call the flu is influenza. And that's something that doctors and nurses have contributed to that confusion for decades. And I apologize on our behalf. A lot of people use the word flu to be a synonym for any kind of virus. You've got a little flu. You've got a flu bug. You've got a stomach flu. Okay, so let's clear that up right now. The flu vaccine is against influenza A and influenza B viruses. That's it. They're very important viruses. They're very common. They're very contagious. They're dangerous. They happen every single year. It's not like a pandemic. Every year we're going to have the flu in the winter, and we know it. And that's what the influenza vaccine protects against. 4 varieties of influenza now every year. It used to be 3. Now it's 2 A's and 2 B's. It does not protect against every winter virus or every virus because they're not influenza. And the fact that we use the word flu fast and loose, that is a problem that I really want to clarify. So a lot of people, when they have a vomiting and diarrhea virus, they call it the stomach flu. You can call it that, but it is not influenza. It's norovirus or it's rotavirus or it's an enterovirus. It's not influenza. So if you get that, it doesn't mean your flu shot failed because your flu shot was not geared against that virus. If you have a common cold, the common cold is caused by coronaviruses, not the pandemic one, but the routine ones, and there are many of them, and we don't have a vaccine against the common cold. So if you get a cold, it doesn't mean your flu vaccine failed, because that's not influenza either. And there are a lot of other respiratory viruses, including COVID-19, but many older viruses, metapneumovirus, parainfluenza, lots of them, that you can still get even if you get an influenza vaccine. So the fact that you get some kind of respiratory virus in the winter does not mean that your influenza vaccine failed. So that's important, number one. Number two, sometimes you feel crummy after you get a vaccine, like right after you get a vaccine, not 2 weeks later or whatever, but in the 48 hours after a vaccine. That's true for any vaccine. But those symptoms that you might get after a vaccine, achiness, headache, fatigue, low-grade fever, those are symptoms of your immune response, your own body reacting to the vaccine. So that's how vaccines work. They give a little fraction of a germ or a killed germ or a replica of a germ to wake up your immune system and say, if you see this invader coming in, you need to kill it. And here's a sample of it right now. So practice killing it now. That's what the vaccine does. That's what all vaccines do. And so what happens is you get this little, almost a virus, not a live virus, but a piece of a virus or something, comes into your body, and your white blood cells, which are the main part of your immune system, and there's a bunch of different kinds, go, oh, I got to get rid of this thing. And they go flock to your arm where you got your shot, which makes your arm a little sore and a little red because your white blood cells are in there fighting this thing as practice. And so it gives you soreness, redness, swelling. Any kind of vaccine can do that. And the white blood cells release chemicals that are useful for killing real viruses. They're not useful in this case, but they make you feel crummy as if you had the real virus. They will make you achy. They will make you feverish. They will give you a headache sometimes, not all the time. But that's your immune system practicing. It kind of shows that your shot is working, although if you don't have a reaction, it doesn't mean your shot isn't working. So you can feel kind of crummy for a couple of days after any vaccine, including the influenza vaccine. And that doesn't mean you got the flu. It means your immune system is practicing how to kill this virus. And the way the vaccines work is when the real virus shows up, it remembers how to do it and it does it harder, better, and faster. That's the whole principle behind vaccines. The immune system practices, but that practicing can be uncomfortable. So some people think, okay, I got the flu from the flu shot. No, you felt fluish, but you didn't have the flu because you didn't have an infection and you weren't contagious. Very important differences. The other thing that I have seen happen is a lot of times people are reluctant to get the flu vaccine for whatever reason. They've read on the internet, somebody talked them out of it, whatever. And then they start hearing on the news, once we're into flu season, this is a bad flu. There have been this many hospitalizations, there have been this many deaths, or they hear that their kid was exposed at school, or something happens, and they think, you know what? I should probably do that, and I should go get this vaccine. And yes, you should. If you haven't gotten it, it is not too late, right? Even if you're in the middle of flu season, even if you're at the end of flu season, it is not too late to get the vaccine. You should get it. However, you need to know that it takes your body's immune system about 2 weeks to get to full protection after the shot. So if you wait until we're in the middle of our annual flu outbreak to get your shot, and then you go someplace, either the drugstore or your doctor's waiting room or whatever, to get the shot, you may be surrounded by people who already have influenza and who are coughing and sneezing and touching things. And so you might be getting exposed to them while you're going to get your shot. Should you still get it? Yes, you should. But you have to understand that if you wait until you're well into flu season to get your shot, it might be too late to get your full protection, and you might get the disease anyway. That also is not a failure of the influenza vaccine. But you don't know when you're going to get exposed. So if you're late, do it anyway. So those are the, did I cover all the questions about getting the flu vaccine anyway? Oh, my kid doesn't get the flu. Did I miss that one? Was that in there?
Yeah.
So that's luck. That's what that is. So I like to use an analogy of a seatbelt. I hope all of you always put on your seatbelt whenever you're in the car, and especially when you're driving, but whenever you're in the car, and you put your kid in a seatbelt or the car seat or the booster, whatever you got to do, every time, no exceptions. I never, ever, ever miss. However, once or twice a year, I'm late putting on my seatbelt because I'm getting in the car and I'm about to turn it on. And before I turn it on, I'm going to put my seatbelt on and my phone rings. And it interrupts my routine. And I finish on the phone and I start the car because I don't remember that I didn't put the seatbelt on yet. And I back out of my driveway and I start driving. I think, oh my God, I don't have my seatbelt on. And I pull over to the side of the road and I put the seatbelt on, right? That's happened to everybody, I'm sure. You went a little ways without your seatbelt and thought, uh-oh, better put the seatbelt on. Well, you didn't die without your seatbelt. Does that mean you didn't need the seatbelt? No, it means you were lucky, right? It doesn't mean that you're not going to, you could have gotten in a car crash in that 20 feet that you drove without your seatbelt and you would have been in trouble, but you got lucky. I think the same thing is true with influenza. You take the chance, you forget, you don't get around to it. Some years there have been shortages. You didn't get your flu vaccine on time and you got lucky. That doesn't mean you're going to be lucky the next time. It's just luck. And I don't like to put my health in the hands of luck. I'm not that kind of a gambler. I hope you're not that kind of a gambler. I didn't want to take that gamble for my family or for my patients. I don't want to rely on luck. And I had plenty of patients over the years that were like, we never get sick, and all this kind of, we don't get sick, we don't get the flu. And it's like, I would try to convince people and they wouldn't listen. And then 1 year, maybe it was after 5 years of good luck, 1 year, the whole family got the flu like dominoes, one after another after another. One brought it home from school, gave it to mom, mom gave it to dad, dad gave they gave it to the sister. They wound up having a month of illness because one after another they got it, and they were sicker than dogs, and they would come and say, Dr. Landau, next year I'm getting the flu vaccine. Should I still get it now? And the answer to that was, well, you only had one type of influenza. There's 4 types in the vaccine. Yeah, I would get it now. I would do it still, because you could get the other kind of influenza if it's going to circulate too. So I think that's just luck. Did I cover all the parts of that question, Brynn? Yeah. Okay, good.
And I think that's a great lead into one of the next questions, which is especially relevant this year. You know, when one kid brings it home from school and passes to the family, I think a lot of families think right now, because we're wearing masks or we are not going out as much or we're trying to socially distance, that really the flu vaccine isn't a necessary vaccine this year. How do you address that?
That's a great question. And no, this is one of the questions to which nobody knows the answer, because we have literally never done this before. The last time we had a pandemic like this was 1918, and there are very few people who are still alive who were alive in 1918, and it was a whole different universe. There was no flu vaccine, there was no COVID, totally different. So we don't know. I have some hope that because we will be wearing masks more to protect us from COVID, and because we will be congregating less because of COVID, and that many kids will be doing remote school and many parents will be doing remote work, I have some hope that we might have less contagion from influenza than we do in an average year. It will not be 0. And we don't know whether it will even be less or not. We just don't know. We have never been here before. So what do we know? We know that we will have an influenza outbreak every single winter. It's not like COVID that happens once in 100 years. It happens every year. How big varies from year to year. How severe varies from year to year also, but it will happen. Can you completely protect yourself and your family from exposure to anything? That's really hard to do. You can hide in your house, as I did for the first several months of COVID, because I'm older and I have a fragile family member. And for the first few months, I got all my groceries ordering online. I did not go to the grocery store for several months. After a while, I started with the hand sanitizer and the mask and going during senior hours and, all that kind of stuff, and going way less frequently than usual and trying to assess every little risk. And I don't go anywhere else. Can all of you say that you don't go anywhere else? You may be essential workers. You may have to go to work. Maybe your kid has to go to childcare or is going in person to school. You're going to go to the grocery store. You can't completely eliminate your risk. It might be less this year because of the things that we're doing. We'll find out. But we don't want to find out too late after you're sick with influenza. And that brings me to another issue about influenza and COVID, which is partially this question and partially maybe the next question you were going to ask. But if any of you has ever had to go to the emergency room in January, it's a nightmare. You cut yourself and you need stitches, or your kid breaks his arm on the play structure, whatever. It's a disaster every single year, because every single year we have millions of cases of influenza in the United States, largely amongst people who did not get vaccinated. If you do get vaccinated against influenza, that was a question I think I left out about it not working. It doesn't work to the degree that the measles vaccine works. The measles is our best vaccine. If you get 2 doses of measles vaccine on time, you are 98% protected against measles. It's the best we've got. Is the flu vaccine that good yet? No. Will it be that good someday? Probably. Maybe. But it's not right now. But if I told you that wearing your seatbelt reduced your risk of dying in a car crash by 70%, would you say, well, it's not 100%, I'm not going to wear my seatbelt? No, of course you wouldn't say that. You'd say, I'll take the 70% and I'll drive carefully and I'll do all the other careful things that I need to do to protect myself and my family. But 70% is a big deal. If I said wearing your seatbelt would decrease your risk of dying by 30%, you'd probably still wear the seatbelt. What's the downside? The upside is, so the flu vaccine, it varies in how perfect it is from year to year. I don't think we have time to get into why, but But it dramatically decreases your risk of winding up in the hospital or dead. Dramatically. Even in the years where the match might not be perfect and where you might get some influenza even after the vaccine, it's about a 70-75% reduction in your chance of winding up in the hospital or dying. That's huge. That is worth doing. If you get the sniffles and a little achy, I'll take it. I'm not in the hospital. Back to the emergency room where I was talking about before. Every year, there are so many people sick with influenza, sick enough to go to the emergency room, sick enough to be admitted to the hospital, sick enough to wind up in the ICU, sick enough to die. And so hospitals are overwhelmed every single winter with influenza patients. Every winter. In a bad year, in a good year, it doesn't matter. The ER is a nightmare. So you don't want to get influenza in the COVID pandemic and maybe have a doubly or triply or 10 times more overwhelmed emergency room, hospital, and ICU. To have these both at the same time, we don't even have the capacity here in the Bay Area where we have tons of hospitals, let alone in other areas where there are fewer hospitals. In addition to that, influenza will probably, if you get the disease, will weaken your immune system for some time afterwards and will cause some lung congestion for some time afterwards, even when you're no longer contagious and you're able to go back to work or, that kind of stuff. You're not back to totally normal, maybe for a month. If you've got some underlying conditions, maybe longer than a month, right? Well, we know that that's even more true for COVID. People are having lung symptoms and heart symptoms for months after they've recovered from the acute phase of that virus, and it may alter their immune response as well. So if you get influenza and then you get COVID, your risk of dying of the COVID or winding up in the hospital or the ICU has got to go up. If you get COVID and then you get influenza, the same thing is true. Your body has been weakened and it may not be able to fight the second virus as well as it was able to fight the first virus, and you may wind up in bigger trouble. So maybe we'll have less exposure because of all the things we're doing to protect from COVID. Maybe it'll be enough. Maybe it won't. Could you get way sicker because you get both of them? Yes, you could. Public health and medical experts are pretty certain that if you got one after the other, you would be in bigger trouble than getting either one alone. So the COVID situation is not going to protect us against influenza enough to turn away a flu shot, which is a very low risk procedure with proven efficacy over decades and decades and decades. So that's why I would say that.
Thank you so much. I think we just have time for one quick question. I think we often think of the flu, as you mentioned earlier, as kind of the common cold and not super dangerous. Could you tell us approximately how deadly it usually is in the US?
Yes, absolutely. So in an average flu year, there are between 30,000 and 60,000 deaths in the United States from influenza. Okay, so now at COVID, we're at over 200,000, which is horrific, and we're nowhere near done. But influenza every year in the United States, given all our excellent health care and the availability of a vaccine, kills 30 to 60,000 people. The people who are the most vulnerable are young children, the elderly, and people with underlying conditions, which include asthma, pregnancy, heart disease, diabetes. Pregnancy, okay, is an underlying condition that makes you very vulnerable to the flu. So that's important to understand. But 30 to 60,000 people die, and that does not count the people who are hospitalized who survive, who are in the ICU who survive, who miss a week or two of work and may or may not be paid for that week or two of work, depending upon what their benefits are, right? Or who are just suffer from a lot of misery, or who may get it and do okay and give it to a family member that they love who does not do okay. right? And if you go to that Families Fighting Flu website, you'll see a heartbreaking story by the mom who founded the organization who lost her perfectly healthy 5-year-old boy to influenza in 2009. Perfectly healthy little boy died of influenza. It does happen. There are generally hundreds of pediatric deaths every year, even in California. So it can be quite deadly. When it's not deadly, it can be very serious, cause you hospitalization, misery, medical bills that are hard to pay sometimes. So yeah, you might be lucky and just be miserable for a week. That's the lucky end of getting influenza. The rest of it is worse.
Thank you so much. So I have on the screen some really wonderful resources that Dr. Landaw has shared with us, the Families Fighting Flu. That includes the story of a mom who's become a major flu advocate after losing her healthy 5-year-old child to influenza, as well as healthychildren.org and the CDC information, both of which have information available in English and Spanish.
Right. And the healthychildren.org is from the American Academy of Pediatrics. I don't know why they don't have that in the title, and I cannot see that on the screen right now. So
Apologize.
I want to make sure that the people who will be watching this recording will see it.
You couldn't see my screen?
I cannot. I can see you and me right now, but I don't know what anybody else can see. There it is.
Okay. Sorry, I am tech savvy,
I think
clearly.
you're doing awesome. I could not possibly do this if you weren't doing it. So there you go.
And I will share these slides. And thank you, Dr. Landaw, so much for your time and for your expertise. I would encourage everyone to talk to your manager at La Clínica about options for getting the flu at La Clínica, or talk to your provider to see if your insurance provider can give it to you. I also had an experience recently at a CVS or Walgreens where they were offering free flu vaccines regardless of your insurance. So if you have any further questions, please let me know. And Dr. Landaw, thank you so much for your time and for your input.
Thank you for inviting me. Everybody get your flu shot, wash your hands, wear your mask, avoid big gatherings whenever you can.
Great.
Safe.
Thank you so much.
Thanks, Brynn. Anytime.